Hi, and welcome to the information session about the Pacific Lutheran University School of Nursing, Doctor of Nursing Practice degree. My name is Kathleen Richardson, and I am one of the faculty that teach within the PLU FNP DNP program. I am an emergency nurse practitioner and a family nurse practitioner, and I am the program director for the DNP program and graduate programs at Pacific Lutheran University School of Nursing. I appreciate you joining us today, and if you have any questions, feel free to text them in the chat or hold them to the end, and I will try to answer any questions you might have. So let us get started. So before we get too much into the actual program, I'd like to talk a little bit about the background of the Doctor of Nursing Practice degree. It started, the idea of having a clinical practice doctorate started approximately 15 years ago. They realized in healthcare that the changing demands and the complexity of patients and the increasing need for additional quality and safety in healthcare required a little bit more expertise and training for health professionals in the healthcare environment. Many professionals already have a practice doctorate. Physicians have a clinical practice doctorate, dentists, PharmDs, PsyDs, the doctor of physical therapy, the audiometry doctors, the Juris Doctorate, and even occupational therapy has changed to a clinical doctorate. So nurse practitioners and advanced practice nursing changing to the doctorate is a logical progression of the profession. We at PLU decided to make that change in 2015. We have had a nurse practitioner program since 1993, and it has been a master's program, but in accordance with the National Organization Nurse Practitioner Faculty decree that we have all nurse practitioners starting and entering into practice with a doctorate no later than 2025, we decided to be ahead of the power curve and start preparing our nurse practitioners at the doctoral level as soon as possible. Our first cohort of DNPs graduated in May 2017. This picture is actually a picture of our very first cohort, and since then, we have graduated a total of 3 cohorts, each a little bit larger in size. And we have actually added a psych mental health nurse practitioner program to our DNP program as well. There's 3 different paths to getting your DNP at Pacific Lutheran University. There is the BSN to DNP, the MSN to DNP, and the MSN ARNP to DNP. The BSN to DNP is set up for a BSN prepared RN who wants to go straight from being an RN to a DNP nurse practitioner. It is a 3-year program full-time, or it could be 4 years part-time. The second 2 years are mostly full-time. The MSN seeking DNP would be someone that's master's prepared. Maybe they are a clinical nurse specialist, or they are an advanced generalist who has decided they want to become a nurse practitioner and also get their doctorate. And we have 2 specialty focus areas. The first is the family nurse practitioner, and the second is the psych mental health nurse practitioner. What we do is when those individuals apply to the program, we conduct a gap analysis to take a look at the students' transcripts and the courses that they've already taken to make sure that we create a program or a progression that is specific to them. If they've already had advanced pathophysiology, for example, we are able to go ahead and give them constructive credit so they don't have to retake that course. Typically, it's a 2-year full-time track, but that really depends upon the gap analysis. It may be 2.5 years, but again, that's individual to the person who is applying. The MSN, ARNP, CKN, DNP is set up for someone already who is an advanced practice nurse practitioner, and they just want to come back and complete their doctorate. So that individual already has their master's, they are already certified as family or psych or pediatric or other type of nurse practitioner. We are just able to get you the doctoral courses, and you are able to graduate with your doctorate in nursing practice. Again, we conduct a gap analysis so you don't have to retake any courses that you might have previously taken. The family nurse practitioner role is what we prepare all our FNPs for. We also, like I said, have the psych, and I'm going to focus on the family nurse practitioner. The program prepares our nurse practitioners to diagnose and prescribe and practice in an environment where nurse practitioners are independently practicing. Washington State is unique in the fact that we are an independent practice state. So the clinical preceptors that the students do their clinical hours with are able to practice independently. They are not dependent upon a physician to make their decisions and to make those treatment plans. They still can collaborate, and you'll be in a collaborative practice to where if you do need some expertise from a specialist, you're able to reach out, but you will be able to practice fully and understand what it means to be an independent, full practice nurse practitioner. The family nurse practitioner serves as a primary care provider for the full family. That means we care for patients from as early as birth to the elderly. We are able to focus in a certain area, but your practice will and preparation will be to work in any area at any age group. We also do our clinical rotations at not just family care. We may have you do pediatric rotations, women's health rotations, internal med rotations to give you a little bit of extra expertise. And the majority of our students do their clinical rotations in Pierce County, although there are some individuals who live further outside of Pierce County, and we try to make sure that we get you as close to your home so you don't have to drive as far as possible. Sometimes that's unavoidable because we want you to have specific clinical experiences. Pierce County and most Washington State are all medically underserved areas, which means there is a healthcare provider shortage, and there are patients who have a very difficult time getting in to see their primary care providers. So we are preparing you to be a provider in areas that are desperately needed for healthcare providers, and you can work in any type of environment, be that a metropolis like Seattle or a rural area like Chehalis. This is an example of our DNP FNP curriculum. The example is set up as a traditional full-time nurse practitioner. As you can see, this very first year of the program is focused on the theory and things that are needed specifically for the doctoral level. You learn about your advanced practice role as a nurse practitioner. You will take theoretical foundations to help understand the underpinnings of nursing as they apply to being an advanced practice nurse. And you'll start learning about informatics and information systems that will help you as a clinician and as a doctorally prepared nurse to be successful in your career. The next semester, you move into the leadership, epidemiology, you start moving towards your nurse practitioner courses. And in the spring, that's when you will start your pathophysiology and your pharmacotherapeutics. And in the summer of the second year is when you start your advanced physical assessment. That second year launches you into your core nurse practitioner courses. You'll be able to start doing your clinical hours. So anything that says FNP, Family Nurse Practitioner 1, Family Nurse Practitioner 2, Women and Children, all those courses have 120 clinical hours associated with them, and that's where you'll be paired with your preceptor in these different clinical environments. The third year, you will be continuing on with your family nurse practitioner clinical rotations, and you will be implementing your Doctor of Nursing Practice scholarly project. A lot of people have questions about scholarly projects. You do not have to have a topic or a subject already selected for these projects. We anticipate that as you go through that first and second year of the program, you'll identify something that really resonates with you, and that will be where your focus is for your Doctor of Nursing Practice project. And we will be there to help you figure out how to implement that and to make it a reality. During the final year, we also have, in our final semester, the transition to DNP practice. During that class, we help you look at what you need to do to take your nurse practitioner boards, to obtain your nurse practitioner license, how to negotiate your salary and get that first job as a nurse practitioner. And we also introduce you to some of the different residencies that are out there if you do want to do a nurse practitioner residency program. This is an example of the part-time curriculum if you were going to do it over 4 years. You'll note that what really happens in the 4-year plan is that the first year, the basics are spread across 2 years, but the last 2 years of the program are very similar to the 3-year program. The big thing I want to point out is that first year of the full-time and that first year or first 2 years of the part-time, you might be able to work, you may not be able to work full-time. And it is very, very difficult to work full-time during the last 2 years of the program, either track you take. Our recommendation is that you not work full-time during those so that you can spend the time and the effort needed to be successful in your clinical rotations and your clinical courses. And a lot of people elect to go per diem so that they are able to still keep their health insurance, but not have to have those competing factors. And that tends to work very well for them. Some individuals are actually able to not have to work, and that is optimal, but we know that life really happens. So we recommend that if you are coming, that you have a plan so that you don't have to work full-time during the program. We also offer a postgraduate certificate. If anybody is already a practicing nurse practitioner, they can come and earn their FNP or their Psych Mental Health NP certificate. This is for nurses with a doctorate in nursing. So somebody that has a PhD may also be able to come back and add that specialty to their program or to their practice. And we also do a gap analysis so that you don't have to retake courses you may have already taken. The cost is not too bad, although it's kind of overwhelming when you first look at the total cost of the program. We've given you an example here of the cost for the Family Nurse Practitioner program and the Psych Mental Health Nurse Practitioner programs. These are the 2019-2020 rates, and the cost is the same whether you are in the 3-year program or in the 4-year program, because the classes that you take are exactly the same. We've given you a little bit of an example of what the costs are at 2 of the other nurse practitioner programs in the area so that you have an understanding of our costs and are able to compare to these other programs. I know that looked like a lot of money, and there are a lot of ways to help pay for your schooling. The big things I wanted to point out here are that there are scholarships for nurse practitioner students out there. There is also state and federal loan repayment programs that can help you pay for your tuition and the costs. And on our website, I believe we have a list of additional scholarship opportunities that you are able to look at and apply for. So I would definitely take a look at that, and I would definitely take a look at these other Other options, if you do decide to work in a federally qualified health center, you may be eligible to have loan repayment over a 3-year period for working in that underserved clinic. So that is definitely something you want to look at. In addition to all these, we are currently a recipient of the HRSA Anew grant. What that means is we were awarded $2.8 million of federal money to help us improve the education and ability for students to work with and work in medically underserved areas. We are able to offer our nurse practitioner students who are in their clinical rotations money to offset the tuition costs. And the stipend is available through 2023, and it is available to both family and psych nurse practitioners. There's no application that has to occur to have that. You just have to be enrolled in good standing in the nurse practitioner program and be eligible to receive the funds. There is also on the website, you can see where there is a place to apply for Dean Scholarship funding as well to help pay for your education. Some of our admission criteria. Our BSN to DNP candidates, you need to have a bachelor's degree from an accredited school and have a minimum GPA of 3.0. We have applicants that have a wide range of GPAs, but typically our applicants have a higher than a 3.5 GPA that get in, but I would say still apply because you may have additional qualities that make you equally competitive with the other individuals that are applying to the program. You need to have a current Washington license, or if you are not licensed currently in Washington, you need to be eligible to be able to obtain your Washington RN license prior to starting courses. You need to have a college level statistics course with a B or better. We do not have any criteria that it has to be within a certain time frame as long as you have had college level statistics with a B or better. But I would recommend that if it's been 20 or 30 years, you might want to brush up on those before you start the program. And we prefer that you've had some direct RN experience to where you have worked with patients, only because that allows you the opportunity to have some experience and maybe understand physical assessment and working with patients a little bit better, but that is not a requirement. Our postmaster's DNP candidates must have an MSN from an accredited school, a current Washington RN license, or again, be eligible to obtain a Washington RN license prior to starting. Again, a college level statistics with a B. And again, we prefer direct care as an RN or an NP. And if you are already a nurse practitioner, we would need you to submit a copy of your current advanced practice certification. The application is very simple. You are able to go to nursingcast.org, and that will walk you through the process step by step. You will need to submit a resume and transcripts from all programs attended. And there are 2 questions, essays that you will upload. The first one is, how will becoming a nurse practitioner meet your career goals? And the other is, how will obtaining a DNP meet your career goals? This gives us a chance to learn a little bit more about you and understand how much you know about what being a nurse practitioner and a doctorally prepared nurse practitioner mean. So those are important. We also ask that you have at least 2 recommendations from people who can really speak to your ability to be a graduate student and also professionally. If you haven't recently been in school and maybe it's been a while and you don't have a good connection with one of your previous professors, find somebody that you work with that knows you well, that is able to still talk to your ability to do graduate level work. And when you have somebody that is giving you a professional reference, it is better if that individual is a healthcare provider and that they understand the role of the nurse practitioner, so they understand what role that you're going into, so they can specifically speak to that. If you are a postmaster's applicant, it is good for us to have verification your clinical hours in your MSN program. The Doctor of Nursing practice requires that all DNP graduates have a minimum of 1,000 clinical hours that are obtained post-baccalaureate, which means that those MSN hours will be able to be added and help you, they'll demonstrate that you have the clinical hours necessary to graduate. The FNP program requires you to have 600 clinical hours anyway, and then your DNP project typically takes 400 hours, but those MSN hours may come in handy if your project only takes 300 hours, for example. Once you have applied and verified your application online, then we will go ahead and evaluate your application. And once you have been offered admissions, that's when we would go ahead and start your background check. It's the same type of background check that we did when you started your RN program. The target date for applicants, a priority deadline is December 1st. That allows us to start looking at applications and allows us to start offering seats in our cohorts as soon as possible to give you time to plan for your life. And we'll continue to do rolling admissions until the cohort is full. So if you don't have your application in by December 1st, that doesn't mean that you will be excluded from being able to be admitted, but it would mean that you would definitely have first look. Our postmaster's option is rolling admissions. Again, we have a priority deadline of December 1st, and we also have, we look at your rolling. So depending on your gap analysis, that may indicate when you start the program. So where it says that we've got this J term or spring start, those comments on there, those are just an idea. That doesn't necessarily mean that's when you would start. Your start date will really depend on your gap analysis. And the December 1st deadline, again, is the priority, but we will do rolling admissions. And this is a copy of our website. If you have any questions, you can talk to grad admissions here. You also have a copy of my email address. And if you wanted to reach out, feel free to ask any questions. This is again our first cohort, our graduates, and I am going to open up the floor for any questions. I know there's been some chat. Okay.
You can put question in the Q&A.
Okay. So if you have any questions, just go ahead and put that into the Q&A session, and I will be able to answer that for you. We're going to go ahead and let me go ahead and see. I am going to look and see, and there are no questions at this point in time.
Go to the chat.
Let me see if I can go to the chat here without.
Chat the first one. Top, the orange one. On the list.
Oh, sorry about that.
Yeah. So that's one question.
So is there an accelerated BSN program as well before the DNP? That is a very good question. Currently, we do not have an accelerated BSN program, though we are looking at that. We do have an accelerated master's level program, which we call the entry-level master's program for somebody who does not have a grad or a nursing degree, but they have a degree in another program. So we would be able to have you be part of that. There are other BSN programs in the area, and if you were to participate in that, we would definitely be able to welcome you in, you know, as an applicant for the BSN to DNP program. So if you're ready to start, I would say go ahead and look at some of the other accelerated BSN programs and then apply toward DNP. If you are still feeling everything out, in the next few years, you might be seeing that we have that offer, in which case that would be a direct pathway to our DNP program. You would take the accelerated BSN, at the end of that, be able to apply for our DNP program. The next question I have on here is, I have an MSN in nursing education that didn't require clinical hours. Would I still qualify for the MSN to DNP program? And the answer is yes. What we would do is we would take a look at the courses that you did take, and we would look and see if there is any overlap, and we would give you constructive credit for those. And if there aren't any clinical hours, that is perfectly fine. The way we have the program set up is that you would be able to obtain all the clinical hours you need within the program. So you should not have to worry about that. You would still qualify for the MSN to DNP program because you have an MSN. Are there any other questions that anyone might have? I know one question that I get sometimes is, do I have to find my clinical preceptor? And the answer is no, you do not have to find your clinical preceptors. That is our responsibility. We find your clinical preceptors. We find your clinical sites. We make sure that it is at a reputable location. We make sure that your clinical preceptor has the qualifications and certifications required to precept you. We do site visits out to see how you are doing at those clinical sites, and we obtain feedback from you about the experience so that we can make sure that we continue to send our students only to places that meet our student needs. So the next question I have is, are the clinical places out inside of school, or how far are they from the campus usually? This really depends. We don't have a school-based clinic yet within the university. That is actually something we are working on and anticipate we'll have in place within the next 2 years. We have started the process, and we are identifying which building to have that within. So that is something that will be an option. We do have a clinical site that is actually at the Student Wellness Center as well. Most of ours will be throughout Pierce County. So it might be anywhere from 5 miles to 30 miles from the university. But we have students that live in Bellingham, and we have allowed them to do we found clinical placements for them up in the Bellingham area. So although it's a greater distance than that, then from the school, it's actually closer to that individual's home, so they don't have to drive clear down to the university. So the clinical placements are anywhere within the, I'll say within roughly a 50-mile radius, though we did have some students who wanted to have immersions during the summer. We were able to place one who has family in OMAC, and that individual spent 2 weeks doing their clinicals in OMAC. And we had another one who spent 2 weeks doing theirs in Yakima. And this fall, we actually have somebody that is actually going up to Squim. So even though it's a 2-hour drive away, it's not, or 2-hour drive from the school, it's not from their home. So we usually, we take all that into consideration. The additional part of that question is, and is there extra cost for the clinical placements? There is no cost for the clinical placements. Clinical placements are our responsibility, and it's part of your tuition that you are paying for. You should never, ever have to pay anyone for clinical placements. That is not, it's not something that is typically done, and it adds an extra cost and level of stress on the student, and that is something that we do for you. It is at no cost. I'm glad I could answer your questions. Are there any other questions? All right, I'm not seeing any more questions. So what I'll do is definitely, if you have any additional questions, or in the shower in the morning and you think of your question, get out of the shower first, but then go ahead and send us an email and we can answer them for you. If you need any help or anything, just let us know. I would really like to have you join us here at PLU, and we really appreciate you taking the time to learn a little bit more about us, and hopefully we are your school of choice. Have a good evening.